welcome to the deep dive. Today, we're tackling a really significant issue, something that touches so many lives, especially for folks injured at work: chronic pain.
It's a huge topic.
Definitely. We're going to be digging into the article Pain Points: Chronic Pain and the Injured Worker from Healthy Systems. Our mission today is really to, cut through some of the complexity and understand what's really going on here.
Absolutely. And, we hear a lot about the efforts to manage pain differently, especially moving away from opioids in workers' comp, which is definitely important progress.
Right.
But the core problem, the chronic pain itself, well, that's still a massive hurdle. It impacts individuals so profoundly and, frankly, creates big challenges for the workplace, too.
Okay, so let's unpack this then. When we actually talk about chronic pain, what are we defining? The Healthy Systems article gives us some guidance here, right?
It does. And interestingly, there isn't just one single definition everyone uses, but the article highlights a kind of consensus.
Oh.
So the American College of Occupational and Environmental Medicine and the official disability guidelines, they tend to say pain lasting at least 3 months is chronic.
3 months.
Yeah. But then you have the Institute for Chronic Pain, and they define it a bit longer, more than 6 months.
So for someone injured on the job, this means it's more than just the pain right after the injury happened.
Exactly. In workers' compensation, it's often thought of as pain that just keeps going, beyond the normal healing time you'd expect for that specific injury. But it can also be pain that sort of develops separately or maybe adds on top of the original injury pain. Healthy Systems puts it quite well, I think. Pain that continues when it should not.
Pain that continues when it should not. That really captures it.
It does. It's that persistent, often really debilitating pain that becomes the main issue itself.
And the Healthy Systems article, it lists some specific examples, doesn't it? What kinds of conditions are we talking about here for injured workers?
Yeah, it covers quite a range. Things like arthritis and other joint pain. The big one, of course, back pain.
Always back pain?
Always. Cancer pain, fibromyalgia, different kinds of headaches, neck pain, and also neuropathic pain. That's pain coming from nerve damage. It really shows how varied chronic pain can be.
Okay, so we've got a better handle on what it is. Now, what drives it? What causes chronic pain in injured workers? It has to be more complex than just the initial, physical injury, right?
You're absolutely spot on. I mean, yes, the initial tissue damage is obviously a factor, and sometimes the nervous system just stays overly reactive. Those are key physical parts.
Sure.
But the Healthy Systems article really emphasizes how important the psychosocial elements are. Things like depression, anxiety, general emotional distress, and what they call negative affect. You sort of think of that as a persistent negative outlook, pessimism about the injury. All these can play a really significant role in developing and, crucially, maintaining chronic pain.
And I recall the article mentioning something specific, catastrophizing. What does that involve for someone recovering from a work injury?
Right, catastrophizing. It's basically when an injured worker tends to really focus on the worst possible outcomes, kind of exaggerating the negative aspects of their pain and injury.
Okay.
The article notes that people experiencing high pain levels and who feel like it's really impacting their ability to function, they're more likely to fall into this pattern.
That actually works against them.
Sadly, yes. This negative mindset can become a real barrier to their recovery. It's like a vicious cycle.
Yeah.
The more they catastrophize, the worse they feel, the harder it is to engage in rehabilitation.
Wow. Okay. So their thoughts are almost fighting against their healing. Now, does the Healthy Systems analysis point to specific jobs or maybe other risk factors that make some workers more likely to develop chronic pain after an injury?
Yes, definitely. The article highlights a few occupations where it's more common: healthcare workers, particularly hospital nurses.
All the lifting, I imagine.
Exactly. The physical demands, especially patient lifting, put them at higher risk for low back pain. Construction workers, too, especially older workers, report a lot of persistent back pain.
Makes sense.
And then, maybe less obviously, high-speed boat operators, they actually have a pretty high prevalence, often lower back, neck, and head issues, probably linked to vibration and impacts.
Huh, interesting.
And also workers in petrochemical and petroleum refineries, headaches seem to be a common chronic complaint there, maybe related to, workplace exposures.
That's quite a diverse group. Are there broader risk factors, too, beyond just the job title?
Oh, absolutely. Age is a big one. The chances of having chronic pain generally increase as we get older.
Right.
Other things mentioned include genetics, having had previous injuries, jobs that involve a lot of manual labor, high levels of stress, underlying mental health conditions like depression or anxiety, smoking, and obesity. It's a whole constellation of factors.
That paints a clear picture of who might be more vulnerable. Now, beyond the physical pain itself, what are some of the major complications? How does living with chronic pain really impact people's lives?
The Healthy Systems article is pretty stark about the mental health consequences. There's a significantly increased risk of depression and, tragically, suicide.
Really serious, then.
Very. Research shows a high percentage of people with chronic pain also grapple with anxiety, PTSD, depressive symptoms. Alarmingly, the article points out the risk of suicide is at least doubled in this group, and many experience suicidal thoughts. It just underlines how profoundly this condition affects overall well-being, far beyond just the physical sensation.
That's incredibly sobering. And it's not only their personal lives that are affected, is it? The Healthy Systems article also talks about the ripple effects into the workplace.
Absolutely. Huge impact there. The article discusses presenteeism. People are physically at work, but the pain limits their ability to function effectively, so productivity drops.
Right, they're there, but not really there.
Exactly. And then there's straightforward absenteeism, missing work altogether, plus, of course, higher healthcare costs. Studies show people with chronic pain miss significantly more work days. And for those with severe pain, they're much more likely to be off work long term.
And general productivity takes a hit, too.
Big time. There's a clear link to reduced overall work productivity with quite substantial numbers of work hours lost each week, depending on the type of chronic pain condition.
And according to the Healthy Systems analysis, it even seems to affect how they perceive their job environment.
Yes, that's another concerning finding. The article highlights this correlation where workers dealing with chronic pain are less likely to find their jobs rewarding. They're also more likely to report experiencing threats or abuse at work.
Wow.
More likely to feel their supervisors aren't supportive and perceive more discrimination. And when you look at the big picture, the overall economic burden in the U.S. is just massive, hundreds of billions of dollars annually.
So, given all these challenges, how is the approach to managing pain evolving, particularly with medications in the workers' comp system, as Healthy Systems describes?
Yeah, there's been a really significant shift. Historically, opioids were prescribed quite frequently for acute pain after a work
Standard
injury.
practice, almost.
Pretty much. But the issues with long-term use tolerance, dependence, addiction became very clear, contributing heavily to the opioid crisis we've all heard so much about.
Right.
The good news is the workers' comp industry has actually made pretty significant strides in curbing inappropriate opioid prescribing. There's data showing real reductions.
That's definitely progress. So what are the alternatives being used more now?
Well, common options include nonsteroidal anti-inflammatory drugs, things like ibuprofen and also acetaminophen.
Okay.
Then there are what we call adjuvant analgesics. These are drugs primarily used for other conditions but found to help with pain, like certain antidepressants or anticonvulsants. And also medications specifically to manage related problems, things to help with sleep, anxiety, depression, muscle spasms, which often accompany chronic pain.
And anything new on the horizon?
Yes, actually, it's quite timely. Just this year, January 2025, the FDA approved a totally new class of non-opioid pain reliever. It's a first-in-class drug targeting the pain signaling system in a novel way, intended for moderate to severe pain.
That sounds promising. The Healthy Systems article also mentioned the wider national efforts regarding the opioid crisis, didn't it?
It did, yeah. Briefly touching on the ongoing legal actions and major settlements with pharmaceutical companies. The Purdue Pharma settlement, finalized late last year, 2024, or maybe early this year, 2025, is a huge example. Significant funds from that are earmarked for addiction prevention and treatment.
Okay, so moving away from pills, what about non-pharmacologic treatments? What's gaining ground there for injured workers with chronic pain, according to the Healthy Systems piece?
There's definitely a clear trend towards using more non-drug approaches in workers' comp. The article points out the most frequently billed services are things like active physical medicine.
Like exercises.
Exactly. Exercises the worker does themselves. Then there's passive physical medicine treatments applied by a therapist, like electrical stimulation, heat, cold packs.
Okay.
Also passive manipulations, think manual therapy, massage, chiropractic care. Interventional pain management is common too, which includes things like injections or nerve blocks. And acupuncture is also frequently used.
Are there other, maybe less common but still important treatments mentioned in the Healthy Systems analysis?
Yes, a few others worth noting. Chronic pain rehabilitation programs, These are pretty intensive multidisciplinary programs, often showing good results in pain reduction and improved function.
Right.
There's also cognitive behavioral therapy specifically for chronic pain, CBT-CP. That focuses on changing those negative thought patterns and behaviors we talked about earlier, the ones that can make pain worse.
Like the catastrophizing.
Precisely. And virtual reality, VR, is emerging too. It's showing some early promise, especially for lower back pain. Got FDA authorization back in 2021, I believe, but it's definitely still under investigation. More research needed.
And medical marijuana, the Healthy Systems article touched on that briefly too. How does that fit into the picture?
Yeah, it's definitely emerging more and more. As of February 2024, a lot of states have comprehensive medical marijuana programs, and chronic pain is very often a qualifying condition. There is some evidence suggesting it might help people reduce their opioid use, which is obviously a goal. However, the research is still a bit mixed. The CDC urges caution, saying more clinical evidence is really needed.
So it's not usually a first step. Given how complex chronic pain is and how costly it can become for everyone involved, how vital is it to identify it early in injured workers? What does Healthy Systems say about that?
Oh, it's absolutely critical. The article makes that very clear. Unresolved chronic pain just drives up the complexity and the cost of a workers' comp claim significantly.
I can imagine.
Yeah, it often pops up as a key comorbidity, an additional problem in those really high-cost claims. Sometimes it develops right during the treatment for the original injury. And Healthy Systems data back this up. They found chronic pain mentioned in a fair percentage of all PT evaluations, but that frequency was much, much higher in the more complex claims.
So how can we get better at spotting these at-risk claims sooner? Does the article offer any solutions?
It points towards data analytics and predictive modeling as really helpful tools.
Using data to predict risk.
Yeah, exactly. By analyzing different factors early on in a claim injury type, demographics, initial treatment patterns, maybe even those psychosocial factors, we can get better at identifying workers who are at higher risk of developing chronic pain.
And what does that early identification allow for?
It allows for timely interventions, things like making sure they get the right kind of therapy at the right time, better medication management strategies, providing really crucial patient education about pain, and importantly, getting referrals for psychosocial support if it looks like that's needed. It's about being proactive.
This has been a really, really insightful deep dive guided by that Healthy Systems article, Pain Points, Chronic Pain and the Injured Worker. So to kind of wrap up, chronic pain is clearly a widespread, serious issue for injured workers. It impacts their health, their well-being, their ability to work in so many ways. And while we are seeing some positive shifts, like moving away from over-reliance on opioids, there's this growing range of non-drug treatments and even some emerging options offering hope. And that early identification piece seems absolutely key for better management.
Exactly. And it really leaves you thinking, doesn't it? Considering that complex interplay, which Healthy Systems laid out so well, between the physical pain and all those psychosocial factors, depression, anxiety, catastrophizing, how can we, as a system, create support that's more holistic, more truly individualized for injured workers? How do we better address both the body and the mind to really improve their recovery and their long-term quality of life, especially when you weigh the huge economic costs and, more importantly, the human costs involved that the article highlighted? It's a critical question for us to consider.